and so a little bit about some data analysis. So first, I'll provide a little bit of background on the proposed participant outcome survey and how we got there. And then I'll talk about the goals of the pilot study. And then I'll describe how we recruited grantees to participate. I'll go through our data collection methods, our response rates, and then we'll talk a little bit about some of the lessons learned from this. So in terms of background, as you all know, the goals of Creative Forces Military Healing Arts Network is to improve the health, well-being, and quality of life for military and veteran populations exposed to trauma and their families and caregivers. And to develop the participant outcome survey, which we call the POS, NEA back in, I guess it was 2021, I believe, commissioned some literature reviews to look at literature around what other similar programs were measuring in terms of outcomes. They conducted an evaluation of some of the early Creative Forces pilot community-based programs. And then they also convened a working group with subject matter experts to help guide the program and help solidify and identify what the key outcomes were going to be that we were interested in for this program. And so from that, we've developed a set of 4 primary outcomes that we are interested in, and all of these map onto the national and the grantee program logic models that some of you may have seen at some point, as you were doing your applications and getting familiar with the program. So the 4 outcomes of primary interest that were identified are social connectedness. And this is where participants have supportive relationships in their life and a sense of belonging to the community. Resilience, where participants feel they can rebound from stress, unexpected events, or life's challenges. Independence and successful adaptation to civilian life, where participants have both an individual and shared sense of purpose, as well as positive self-worth that support adapting back to civilian life. Those 3 measures were identified through existing literature and existing surveys and had been really well tested in other similar populations of military and veteran programs. And then the 4th area is called creative expression. And these were some new items developed and tested by NEA to assess whether participants have a better understanding of themselves and others by creating or engaging in art. So these are the 4 primary outcomes that we were looking at in the survey. So the goals of the pilot study, we had 2 primary goals. One was to test and refine the survey's methodology and the administration process. And this is really important because we know that programs are all unique and all of your programs have different models, different length, different timing. Some are what we call maybe semester programs, where they're running for 2 or 3 months and the same participants come weekly. Others are more around, maybe like a one-time drop-in. And so we really needed to understand, if we're going to do a survey like this, how is that going to work given all of the different models out there? And then we did also want to gather some very preliminary data on the actual participant outcomes and try to look to see if we're seeing some change over time after participants are participating in your programs. And then all of this is going to help us determine in 2024 and 25, there are plans to conduct a larger study that will be revised and adapted based on what we find from the pilot study findings. So for a grantee, to recruit the grantees, they were not required to participate in this. They were asked to volunteer to participate. So the grantees who were funded in 2022 were invited. Some of the criteria for inclusion were that they had to have events that were being conducted between January and June of 2023. That was the time frame of our pilot study. And then we wanted also to include programs that had a somewhat more intensive interaction with participants. For example, ongoing classes, maybe a play production, not just a brief one-time workshop type of thing, because we really were trying to see, are we seeing, change over time? And we wanted programs that could be geared toward anyone connected to the military, including family, friends, caregivers. So any program that was even working, and including civilians. Some of these programs are are working with civilians as well. So anybody that was working with any of these populations could be eligible. So the survey was web-based and created using SurveyMonkey. And grantees used one of two different participant recruitment models. So what we call the proactive recruitment models, grantees provided emails of their participants to VMG, and VMG directly emailed the survey link to invite participants to participate in the survey. And then our other model was what we call a passive recruitment model, where VMG provided grantees with flyers that had a web address and information about the study. They handed that out to participants during the initial class. And then participants had to go and enter the email address or go to the website and provide their email address. And then at that point, they would receive an invitation from VMG to participate in the survey. So we had 11 grantees that we invited to participate based on our eligibility requirements, and 7 grantees elected to participate. And their programs really included various service delivery models, ranging from once-a-month classes to a couple of them were 2 or 3 month long, what we call kind of semester courses. So we really did have the range of different types of program models, which is really great because we wanted to be able to understand how this was going to work across a variety of models. And some of the reasons that the grantees declined to participate included they were really expecting such a small number of participants that they really didn't think that it would contribute much to this. Some grantees were already conducting substantial monitoring and evaluation activities and felt like adding this on would be a little bit too much of a burden for their participants, so they declined for that reason. A couple of the grantees had their own institutional review board that would not approve this without going through a whole process of doing that, which would have taken a really long time and probably would have gotten past the time of the study. And then some just said they really just lack the staff capacity to be able to do this. And so our participant response rates of the 7 grantees, 4 collected data through the proactive model and 3 through the passive model. So for our pretest, we had a total of 136 respondents out of 204 who were sent invitations for a response rate of 67%, which is really, really excellent for a web-based survey in this day and age. And as you can see, we did have a much higher response rate for our proactive recruitment model compared to the passive recruitment model. And then for post-test, out of the 135 invitations that were sent out, we had a total of 93. So again, a really high 69% response rate, which is really, really great. We're very excited about that. So this is just to give you a little bit about who our respondents were. Majority female, most were between the ages of 45 and 64. The majority were white, with about 16% Hispanic and 18% other. And just FYI, we collapsed several other categories into one other, mainly because we maybe only had maybe 1 or 2 respondents in each of those categories, and we just have to be a little bit careful from confidentiality reasons to show like very small numbers of cases for this. So we collapsed other groups into other. And then about 37% were veterans or retirees, 25% spouses, and then we had a range of 17% caregivers. And then you can see some active service members, some other healthcare workers, and also some civilians in there as well. So we conducted some focus groups. After we wrapped up in July, we conducted the focus groups with the grantees to be able to learn a little bit more about what their experience was like. And some of the lessons learned that we found is that the proactive recruitment model really did have a much better response rate than the passive model. Relying on folks to take a flyer, go home, go to a website, enter a website address in, provide their email. I think that was a little bit too much to ask of folks to be able to do that. But if we email them directly, it worked pretty well. The study materials that VMG provided to the grantees did make it very easy for the staff to communicate with participants about the survey. So that's something we'll definitely a lesson learned for when we do the larger survey. We did find also too that technology was not really an issue, except for one grantee where they were a program that was embedded in the VA, and the participants did not have access to their cell phones or any devices. And so In that case, technology was an issue, but most reported their respondents or their participants feel comfortable using technology either through phones or computers or what have you. But we did realize that in some cases it might be important to think about providing paper surveys in situations where technology might not be as readily available. Paper surveys might be a good option. And we did from some of the grantees who were introducing the study, the passive model, where they were talking about the study and introducing it to some of their participants in the initial class. They were a little surprised that they had such low participation because they felt like they were getting really good positive nonverbal cues when they were introducing the study. And they gave some reasons why they thought possibly maybe their students or their participants didn't participate. Potentially poor memory or anxiety or stress to complete the survey after they leave the class. Some felt like some participants might have felt surveyed out, given all the other surveys that they're often asked to complete. And then they also mentioned that there could be some limited trust in just getting a web link from an unknown address where they're not familiar with who we are, who it's coming from. And then finally, grantees also did feel that additional funds to support the evaluation would be beneficial and would ensure staff capacity for evaluation activities. So again, thinking about doing this in the future in 24-25, these are some of the things that we've learned and we'll be considering. So for our next steps, we are already starting to conduct analysis of the pre-post results. I will say we are getting some indications of some statistically significant increases in some of the scales, so we're pretty excited about that. We're going to have, because of the small sample size, though, we're going to have some limited capacity to do like subgroup comparisons. We're still working to see where it makes sense, where we've got enough sample size to compare some of those subgroups like gender, age, that kind of thing. But we're looking at that now. And then we'll be providing NEA with a report with recommendations for the next phase of the study. And then as we mentioned, we'll be working toward doing a larger scale survey and also a broader evaluation in the future for 2024 or 2025. Okay, so with that, I'm going to stop sharing. Matt, are we open for questions or should we kind of move on?
I think to preserve time for breakout groups, it'd be best to move on. But if anyone does have any questions, they can feel free to reach out and we can connect them.
Yeah, absolutely great. So with that, I'm handing it over to Debbie Holden, who will report on the for the program feedback survey.
And Debbie, just one moment before you begin. I accidentally opened up the breakout rooms. Just hold on. Everyone has their rooms, but after Debbie's presentation, then Matt will talk about what we're going to be doing in the breakout rooms, and then you can all go there. So my apologies for that accidental button press.
Thanks. Hi, everyone. I'm Debbie Holden. I'm the Director for Research and Evaluation at Veritas, and we started working with MA and Creative Forces about 1.5 years ago now. So we're excited to have a new group to work with and provide technical support and technical assistance and evaluation support. So you might remember in your grant application, is it showing? Because it's not letting me there. Okay. There's a couple of surveys in your package that NEA requests grantees to use in administering your project. So I'll give an overview of that and data collection that's been done so far. How, what the grantees' responses were for the batch from 2022. Some of the findings and study limitations and recommendations. So back in July of last year, there were 26 awarded grantees for a 1 to 2 year community-based project, just like what you've been awarded this year, but there's more of you this year, thank goodness. And there's a program feedback survey that was developed by NEA and has gone through all the government approvals for administration. So they were excited to have it, and it's to collect the feedback from the participants in your actual event. So any of your students or people like that. There's also an audience feedback survey, which is only or event feedback too, it says it's called. And that's for if you're doing something where there's an audience, like a play, putting on a play, something like that. Not a lot of those came in. But we trained folks on how to administer surveys and gave them a unique Survey Monkey link, just like we did for the pilot study in a sense. Data collection took place first half of this year. One grantee printed it out online because she felt that she needed to do that because the instructor that was giving the class wasn't familiar with how to do this. So she just asked them to pass out this survey and do what they wanted. I mean, have people complete it. And the survey included a combination of both close-ended, like scales, and open-ended or free response questions. So I'll summarize some of both. There are the 26. We got a total of 194 survey responses. So they would give them the web link and we would get the responses to come to us. 12 out of the 26 that responded, 12 out of the 26 grantees participated, which was about an average of 7 to 16 people per program. So it's not great. We were hoping to have a little bit more numbers because grantees thought they were going to reach a couple thousand people total. So we're trying to figure out how to do a better job this year of getting more responses. The demographics aren't surprising, really. It was mostly veteran retirees that were involved with the project. Had a really large age range there. So one of the things that we're going to recommend is to break that down a little bit if we can. But 25 to 64 was the bulk of people, and over half were female. Most were white, but had good representation of the Black groups and Hispanics. So they were asked first the greatest benefit and the greatest challenges for participating in the program. And this is the summary of what was said in this responses that were given. So they could say learning and developing new skills and that kind of thing. It was also the challenges, the learning new skills was also a challenge. And so they also were asked to give comments about anything that they responded, and nearly all of them gave at least one comment. Several of them, or many of them, 77 of them said that it was fun and engaging, that they noted that they had learned a new skill, and that was a primary benefit for them. But there was also things that came along with it, like including that they felt a feeling of belongingness, a sense of community, and being with other veterans helped them to kind of come out of their shell. Some of the folks said things like that explained that they were really, at home all the time, not talking to people, and this really helped them get out and be more engaged with people. So it was pretty neat to read the comments that people wrote. For challenges, they the most said that they were the time and location when they wrote comments, because they would complain about when the class was, how long the class was, how far away it was, the usual things like that. And then that, but they also said that, they had already selected some things on the form, but they said pushing boundaries and intense content really got to them and was a challenge for them to cope with. And they had members, and some of them had a lot of physical problems that made it hard to participate, like memory problems where they couldn't remember from week to week or from session to session what they were supposed to do or what they learned last time. And the new and physical and mental challenges. Many of them talked about anxiety and just not being able to sit still very long in the class. I thought that was interesting to note because that could be something that you think about in your design. But some of the specific program findings, most of them had heard about it through people they knew, or they were already involved with the organization that they were in, taking a class in. I did want to mention vet techs. I looked it up there were several people that noted that. And it's apparently an online service that veterans can use to look up events. And I don't know if any of you all know, if everybody knows that, but I thought it was possibly a good resource because several people said they found it last year. So other things that were asked, kind of what I've already mentioned, to what extent they felt welcome in the program and engaged, and the sense of community. And overall, they all, the majority, well over the majority, strongly agreed with the comments like impressions of the program about that they would recommend it to a friend. What happened to sorry. That they felt welcome, that they benefited from the program. Some of the survey limitations that we're going to try to address in the coming few months is that it was specific to the primary limitation were specific to the constraints of the data collection. So like we were only collecting data from January to July of this year. If they had the event before or after that, they're not included in this response. Some of the folks already had, as Kara's mentioned, already had their own surveys that they were using, and they didn't want to use a new survey. And we don't really know a lot about, so there's not a pre for this, there's just a po, you give it out at the end, but we don't really know if they gave it out at the last class or the end of the first class. We explained to them what they should do, but we don't really know if they did that, and how well it went and who administered it and that kind of thing. So some of our recommendations are to provide training for survey administration earlier in the project. We didn't get started until the end of last year giving training on survey administration. So we missed the opportunity with people that had their events last fall to collect some data. And we also feel like if we had told people about it sooner, they might have been better prepared to take on something like this by the time they did their event. We do think there should be a paper and pen version, which somebody had printed out and used in her event. And we think that we're going to provide we'd like to provide a script, but the study's already approved by IRB. And if you don't know about Office of Management and Budget, or OMB, so actually to provide a script would be a change to those, and we might not do that at this time, but it would be a good idea to consider. And that's all I had.
Thank you so much, Debbie. I know that was a lot of information to take in at once, so we can all take a collective breath. But I hope that the challenges and the results of those surveys that we were just described to you resonate you in some way. Because I know many of you, as Debbie and Kara were saying, many of you do implement surveys and have your own data collection. And I imagine that you encounter a lot of the same challenges there. And that's why we thought for our breakout discussion today that we would focus on the question of data collection. So soon we'll be jumping into breakout rooms for about 25 to 30 minutes. First, we'd like to have everybody in the room have a chance to introduce themselves in case everybody doesn't know everybody in there. And then I'd just like to review the community guidelines very quickly. Just a reminder to be a generous listener and allow one person to speak at a time. Remember that this is a public discussion and not a debate. So if you hear other points of view other than your own, listen and respect them and try and see where people are coming from. And along with that, seek first to understand rather than be understood. In that, ask questions to seek clarification if you don't understand what someone's comments mean. So our questions today, I'll just read briefly, but our facilitators will be posting them in the chat. And let me note that